This is a patient case of Sabrina Stanton, whose chief complaint she has been feeling hard to breathe. She is a 22-year female who presented to the urgent care with complaints of shortness of breath. She was found to be tachycardic and hypoxic, which prompted a transfer to the emergency department. The patient felt short of breath suddenly today, which was accompanied with chest heaviness. She has never felt this way before. Nothing has relieved the sensation, and it is worse with exertion. She denies cough, denies hospitalizations or surgeries before. The only medication that she is currently taking is birth control, Yaz, daily. She is allergic to latex, which her reaction is hives. No past medical history, no chronic illnesses, or no hospitalizations or surgeries. Only family history for her is sister who is diagnosed with diabetes type 1. Social history. Patient is currently a student at University of Nevada, works in the cafeteria for work study, currently living with a roommate, no relationships, occasionally sexually active, uses condoms, and is on birth control, denies tobacco, denies marijuana use, social alcohol use about 2 days a week, maximum of 4 drinks a night. She is currently up to date on her vaccinations. She gets her influenza vaccine annually, meningococcal vaccine at the age of 18, Gardasil vaccine at the age of 15. She visits her primary care provider every 3 years, and she gets her pap smear done every 3 years. Review of systems. The only positive findings for Miss Stanton is she is complaining of chest heaviness but denies chest pain, palpitations or edema. Respiratory, she is short of breath, which is worse with exertion. Denies cough, wheezing, dyspnea, or pneumonia. Objective data. Weight is 120 pounds. Temperature on admission is 36 degrees Celsius, 36.8 degrees Fahrenheit. Blood pressure on the left arm is 125/70. Blood pressure on the right arm is 120/74. Pulse is 118. Rhythm is regular. Strength is normal. Respiratory rate is 18 at rest and 24 with exertion. Effort is normal. Labor with exertion. SpO2 currently is 86% on room air. Physical exam. She is a healthy appearing adult female and in no acute distress. Alert oriented, answers all questions appropriately. No rashes or lesions noted on her skin. Head is normal cephalic without lesions and hairs evenly distributed. Cardiovascular, S1, S2 with regular rate and rhythm, no extra sounds, clicks, rubs, or murmurs. Capillary refill, 2 seconds. Respiratory, she is tachypnic, lung sounds are diminished, symmetric chest wall rises, respirations regular and easy. Gastrointestinal, bowel sounds active in all 4 quadrants. Abdomen soft and non-tender. GU, bladder is non-distended, no CV tenderness. Musculoskeletal. Full range of motion seen in all 4 extremities as the patient moved about the exam room. Neurological. Speech is clear, good tone, posture erect, balance stable, no facial droop. Psychiatric, alert-oriented, maintains eye contact, speech is soft and thorough, answers all questions appropriately. Lab tests that were done on her were a BNP with all labs within normal limits. CBC was also within normal limits except her WBC slightly elevated at 11.25. Chest x-ray shows chest x-ray without pleural effusions, pneumothorax consolidation, cardiac outline within normal limits. CT angiogram shows submassive pulmonary embolism with appearance with right ventricle compromise. Thoracic aorta normal caliber and opacification with no evidence of acute abnormalities, no pneumothorax or infiltrates. Urine pregnancy test is negative. Three differential diagnoses is asthma, cardiac tamponade, and pneumothorax. Final diagnosis for her is pulmonary embolism. Treatment plan would include IV fluids as a first-line therapy for patients with hypotension, normal saline at 100 cc's an hour with a 1 liter bolus. Vasopressors if intravenous fluids do not help hypotension. Norepinephrine is usually preferred as first-line vasopressor. Anticoagulation, I would consult pharmacy for heparin drip if there are no contraindications. She would currently have to be off of her birth control at this time. IV morphine 2 milligrams Q4 hours for pain if needed. Patient does need to be admitted to the hospital. Supplemental oxygen needs to be placed for SpO2 greater than 92%. While on a heparin drip, patient needs to have her PTT checked every 6 hours to make sure it's therapeutic. I'd recommend CBC daily to monitor her hemoglobin, make sure there's no bleeding. BNP daily as well. Vital signs should be done Q4 hours. ABG if patient is requiring higher levels of supplemental oxygen or appears to be in respiratory distress. Diagnostic test needed for this patient is a CT angiogram, which was done, which already showed the PE. Transthoracic echocardiogram to assess for right ventricle strain, and ultrasound the bilateral lower extremities to rule out DVTs. Patient education that should be given to the patient is the causes of pulmonary embolisms and the location of her pulmonary embolism, and discuss the risks and benefits of being on a heparin drip to prevent the clot from getting bigger, and to also explain to the patient what a heparin drip does, which is a type of blood thinner. Education should also be given to patients in order to help her to prevent blood clots in the future, which includes standing up and walking around at least once every hour, no smoking, and wearing knee-high compression stockings. Health promotion, patients should continue to get her flu vaccine annually, pap smear when due, COVID vaccine, and visit her primary care physician yearly. Referrals, I would suggest she see her OBGYN to discuss different types of birth control methods, since she can no longer be on the pill. Hematology to follow up for anticoagulation. Possible vascular surgery if patient continues to be symptomatic.